Infertility affects millions of couples worldwide, with approximately 1 in 6 couples experiencing fertility challenges. If you're one of those couples, you are not alone. In today's video, I'll be telling you 5 things your fertility doctor wants you to know. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything women's health and fertility. So if this is the kind of content you're interested in, keep watching. The first thing your fertility doctor wants you to know is that age is a crucial factor when it comes to fertility. Let me tell you a story. When every female child is born, she's born with a particular amount of eggs in her ovaries, and those are all the eggs she's going to have. So when she gets to puberty and she starts to menstruate and she starts to see her period, she starts to release a particular amount of these eggs every month. As her ovaries are releasing these eggs, the amount of eggs left are reducing. So there's nothing replacing these eggs. Nobody is coming to open the ovaries to put in new eggs. Simply put, as she ages, the amount of eggs left declines. By the time the woman gets to 35 years old, the amount of eggs left in her ovaries have significantly declined. And note that it's not the same for every woman. Yes, it has significantly declined for every woman, but what is left is not the same for every woman. Some women will still have more than others. So even though the increase in age causes a decline in fertility, it doesn't mean that when a woman is above 35, she can't give birth. She can still give birth. It's just that compared to a woman that is 35 and younger, it may take longer for her to conceive. So your fertility doctor wants you to know that age is important, time is of essence. So if you're getting older, your eggs are reducing, and when you've gotten to 35 and above, your eggs have significantly reduced. So when you're trying to conceive, you have to be proactive. You have to know the right things to do. You have to know your safe period, your fertile period. This is very important. This is very key when trying to conceive. In a month, every woman has about 6 days where she is fertile. So you need to be able to calculate your fertile window. You also need to do the standard infertility test, the hormonal test that lets you know the amount of eggs left in your ovaries. And if after you've tried for a few months and you're not successful, you need to visit your fertility physician to have a discussion and to figure out the appropriate option for you. Your fertility doctor also wants you to know that lifestyle can affect your fertility. Lifestyle like smoking, this affects both the egg and the sperm. Being overweight also affects both the egg and the sperm. Also, drinking too much affects the egg and the sperm. So when you're trying to conceive, try to maintain a healthy weight, stop smoking, reduce the amount of alcohol. When you're trying to conceive, it is essential to live a healthy lifestyle. Exercise, eat fruits and vegetables, more leafy vegetables, fruits, nuts if you are not allergic, fish as well. All these are essential in maintaining a healthy weight and improving your reproductive health. The third thing your fertility doctor wants you to know is that there are different types of fertility treatments available. So if you're finding it difficult to conceive naturally, there are other options. For example, timed intercourse. So with a timed intercourse, your doctor can decide to give you oral medications that will help stimulate your ovaries to produce eggs, and then for the egg to mature and to be released, that's for ovulation to occur. And when this is happening, your doctor will be tracking your ovulation, will be tracking the follicles, that's the sacs of fluid that contains the egg on your ovary, with an ultrasound scan. So you will have multiple visits to the hospital, roughly about 5 visits to the hospital. And then when your egg is mature enough to be released, your doctor will tell you when to have sexual intercourse with your partner. That's why it is called timed intercourse, because your doctor is timing the intercourse. You and your doctor are timing the intercourse. This increases a couple's chance of getting pregnant. Other treatment options include intrauterine insemination, IUI. With IUI and also timed intercourse, before the procedure starts, all of your infertility investigations would have been done, because for you to do IUI or even the timed intercourse I just mentioned, your partner's sperm has to be healthy. That says it has to have normal sperm count, normal motility. And the woman's hormonal investigations should show that there is still a healthy communication between her brain and her ovaries, so she's still producing good and quality and enough eggs. And also her fallopian tubes have to be opened. So before a timed intercourse or an IUI, we have to do a procedure called HSG. hysterosalpingogram, to ensure that the fallopian tubes are open, that is, they are not blocked. Because remember how fertilization occurs. The sperm has to go through the vagina, into the cervix, all the way into the fallopian tubes. So if the fallopian tubes are blocked, there is no place for the sperm to pass to get to the egg, because the egg will be released from the ovary into the fallopian tube. So back to the IUI process. What happens is we give you a medication. Your doctor will give you a medication to stimulate your ovaries to produce eggs. So when you use these medications to stimulate the ovaries, one of the side effects is multiple pregnancies. So your ovaries might release more than one egg, but ideally we don't want more than 2 eggs during IUI. So the difference between IUI and timed intercourse is that when the eggs are mature, we invite your partner to the clinic so that we can collect his sperm and transfer his sperm into your uterus. So it could be done with either your partner's sperm or a donor sperm. So once the sperm is collected, we wash the sperm, collect only the healthiest, fastest sperm, and those are the sperm cells that we are transferring into the uterus. Like I said, in IUI, we can use either your partner's sperm or a donor sperm, that is a younger man's sperm, a healthier sperm. But we can't use a donor egg because it is your ovaries that we are stimulating to produce the egg. Another fertility treatment option is IVF, in vitro fertilization. In this case, we just use advanced technology to help a couple finding it difficult to get pregnant. So what we do is we take the egg out of the woman's body, take the sperm out of the man's body, put it inside a dish, put it in an incubator, fertilization will occur, and after 3 to 5 days, we will bring out the resultant embryo, and then we'll transfer this embryo inside the uterus. 10 to 14 days after the transfer, you do a pregnancy test to see if it was successful. In IVF, you can also use a donor egg, that is a younger woman's egg. You can use a donor sperm, a younger man's sperm. You can use your egg, you can use your partner's sperm. You can even do surrogacy, that is, you take your egg, your partner's sperm, and we transfer the embryo inside another woman's womb. So these are the various options that are available to assist you in conceiving. Fertility treatment is not a one-size-fits-all solution. To each her own. It is an individualized process. Each person's fertility journey is unique. And the type of treatment that is right for you will depend on various factors, which includes your age, your medical history, and your fertility goals. So it is important to work closely with your fertility specialist to develop a personalized treatment plan that is tailored to your needs. The first thing your fertility doctor wants you to know is that emotional support is crucial in your fertility journey. Your doctor should be able to talk about the emotional toll that fertility challenges can take on individuals and couples. Dealing with infertility can be emotionally challenging, and it is important to seek emotional support during your fertility journey. Whether it is through counseling or talking to family and friends, having a support system, an emotional support system, can make a significant difference in your overall well-being. The fifth and final thing that your fertility doctor wants you to know is that there is hope. There are stories of several couples that have tried for several years before achieving success, whether it is naturally or through fertility treatments. Some couples, when they finally achieve success, it could be 1 baby or 2 babies or 3 or 4 babies at once. While infertility can be very challenging, there is hope. Many couples have successfully conceived with the help of fertility treatments. New advances in technology are continuously improving success rates. So whether it is naturally or through fertility treatments, there are available options to help you achieve your dreams of getting pregnant. And remember, I am rooting for you. If you found this video informative and you want more content like this, subscribe to my channel, like this video, drop your questions in the comment section below, and see you in my next video.